You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast. Here we go, guys. 2021 is here, a year filled with hope and the promise of something better to come. I think it's fair to say, no matter what 2020 was like for you, you are anticipating things to be better. But in order for that to happen, there may be some action steps you will need to take to ensure you end up in a better place tomorrow than where you stand today. No matter what your goals are, it's been my experience that achieving them require focus, energy, and a plan. And on my list of priorities should be the optimization of our health so that we have a body capable of both mentally and physically helping us achieve our goals. One of the most impactful ways to ensure this happens is by feeding your body the right nutrition and your brain the right information. Today, my guest will inspire you with her story of survival, a story I hope will allow you to put your own struggles into perspective as you work to overcome them. We could all benefit from the guidance of someone who has been there and done that so that we can avoid some of the pitfalls that may face our future as we try to overcome our struggles. Dr. Sheri is a visionary, best-selling author and sought-after physician leader. She is a board-certified occupational and environmental medicine physician, public health expert, and a breast cancer survivor. After breast cancer treatment left her disabled from lymphedema in her right upper extremity, stripping her of her lifelong dream of being a practicing physician, she reinvented herself and went on to become a national public figure, professional speaker, and entrepreneur and owner of her own healthcare consulting business. She has been the catalyst for a transformation in the space of culture and workplace diversity for more than 2 decades. She launched her TV show, The Live Today, on CAN TV Channel 21, as well as her own podcast, Where Medicine Meets Ministry. Dr. Sheri talks faith and facts. So, Dr. Sheri, I want to welcome you to Protecting Your Nest.
Thank you so much for being a guest, allowing me to be a guest on your podcast. I think it's so important. And the title of your podcast, it rang true to me. And that's something that I think sometimes we take lightly and we don't think about. We kind of go through life without thinking about what it takes to really protect your nest and what your nest is. So thank you for the opportunity.
Yeah, it's incredible. Even as we share your story, I think in some ways you're a bird that hovers over a nest as well. You've tried to protect a whole lot of nest over your lifetime. So I really appreciate that. I think women in particular are very good at that. Just making sure everybody in the nest are protected. So I really appreciate that. One of the things that a lot of people may not know about is your training. So, occupational and environmental medicine is something that you don't hear about every day. So let's start with that. Let's tell the listeners, what that is, first of all, and why you chose to specialize in that area.
Well, I really appreciate the question because most people, when they hear occupational and environmental medicine, immediately think, oh, you're in occupational therapy. I'm thinking, no, very, very different. Actually, I started off in neurology. I was going to be a neurologist and had completed about 1.5 years of neurology training when I became pregnant with my second child, had complications, and was pretty much given the ultimatum by my OB. You can either continue working and lose your child and or your life, or you can take a leave of absence and work your way towards having a healthy pregnancy. So I did. But after being at home for about 2 months and my oldest daughter was about to turn 2, having been a physician and being in school and multitasking, having so many things at hand at one time, I found myself being at home with my nearly 2-year-old and pregnant, and I was about to lose my mind. I'm like, I got to keep myself busy. How can I continue to stay and keep my hands in the pulse of medicine while still protecting my unborn child. And so I started to moonlight. And I moonlighted with the permission of my OB, who stated I could only work jobs that were 9 to 5, did not require call, no weekends, and it wouldn't put me on my feet all day. And so I started working with the locum tenens company, and they kept putting me in facilities that they kept saying they would use the term work comp clinic or urgent care or something to that nature, using a term that I really hadn't heard in medical school. I had about a week worth of preventive medicine taught, but never heard about the field of occupational and environmental medicine until I started moonlighting. And so after about 6 months of moonlighting in this area, I realized this may be a real field. So I did some research and found out that it was. The
Mhm.
field of occupational and environmental medicine is two parts. One, occupational, dealing with occupational hazards, work comp injuries and illnesses, working with CDC, OSHA, doing the specialty exams like police, fire department, FBI, even truck drivers. All of those entities have specific physical examination requirements that need to be met in order for that individual to be in that job. And you have to understand their work environment and what's at risk in order for you to make the decision whether or not he or she is well enough and or capable enough of performing that particular job function. And that was what I was doing when I was moonlighting. And the environmental specialist part of it comes in when there are individuals that may be exposed. Let's say they go to Home Depot, they buy a product spills all over them or splashes in their eye, causes some type of adverse reaction. But yet when they look at the label, that there was no notice that this would cause this particular harm. And so that type of individual will now come and seek out a doctor like me and say, hey, what is this new rash? What is this new bump? Or I'm developing new symptoms. I would inquire what their exposure was. And then now we can get to a cause as to what their injury was and who may or may not have been at fault. And so that's what occupational and environmental medicine does. We cover work environment, and then we cover your home and other outside environments. So pretty much almost every acronym you can think of, CDC, like I mentioned, OSHA, EPA, all of that, I was trained to understand and know the rules and regs so that I can make sure everyone is working and or living in a healthful environment.
That was a very thorough and excellent response. And I'd be willing to bet that there are some clinicians who learned a little bit because we just take that for granted. And I think most of them understand the part that deals with, well, if you're at work and you need to go see a doc, work related, they'll send you in that direction. But I'm not sure they saw the full picture. So that really is helpful. And I was just curious because I wanted to make sure that the audience understood your background. And I'm thinking now about your background as it relates to breast cancer and being a survivor. And I think about my mom,
Mm-hmm.
who I remember it so well. She was diagnosed about 21 years ago. And I always remember the number of years because I have a 21-year-old. And I think my wife
Oh.
was pregnant at the time. And so I never forget the number of years. And we had like two family members on my wife's side of the family who passed. And you know how some people say these things come in threes, right? So
Mm-hmm.
I was like, oh my God, my mom's about to leave me. And I need somebody to take care of these babies. So
Right, right.
that's all I was thinking about. That just came to me as I was talking. I was like, I need somebody to help me out. Anyway, watching the struggles that she went through, all the decisions she had to make, and just having a potentially life-ending diagnosis and how it impacts the whole family. I'm just so thankful that she did well, and I'm also thankful that you did well. So I think I want you to just share with the listeners, what's your story? Let's go backwards and see how you came from where you were to who you are today.
Yeah, I think mine is sometimes I say an interesting one, but probably just an ordinary one too. I when I was diagnosed, well, prior to being diagnosed, as a physician, even in the world and realm of occupational and environmental medicine, throughout my training and even in my practicing, I had rendered the diagnosis on many occasions. Every single time I rendered the diagnosis, it it pulled at my heartstrings and left me feeling so empty, because I felt like, okay, I'm not the oncologist, right? So I'm giving you the diagnosis, and now I'm turning your care over. And I felt like, oh wow, I've just given them such devastating news. And anytime I ever gave that diagnosis, I was fortunate enough to give the diagnosis to individuals who were faith based. And so at least the one thing that I did before I left was that prayed with the patient and or the family members that were there. And I remember being scolded by my attending physicians for taking such a personal step with my patients. They kind of told me, Sheri, you're not going to last in this business for long if you keep going so deep. So you got to learn how to remove yourself. I just couldn't bring myself to do that. And I'm so grateful that I did not listen to them, and I listened to my heart. So fast forward about, 15 years into practicing, helping thousands of individuals. I'm in a position with an organization that I thought, "Yeah, this is where I'm going to be. I'm here. I can grow enough here. This will probably be where I retire. There's enough for me to do. I'm impacting the community." And then lo and behold, one of my close work colleagues was diagnosed with breast cancer, in addition to a friend of mine who had been diagnosed. The friend of mine who had been diagnosed, unfortunately, did not share her story with anyone. We found out that she was diagnosed pretty much hours before she died. And so I had that one example of someone who gets diagnosed, keeps it to themselves. They're going to pray themselves through it. And lo and behold, they don't live longer than 6 months. And then I had this colleague who was diagnosed, and she asked, and she was close to me. She asked, Sheri, could you be my point of contact? Could you be my person? And by her person, that was a person who went to all of her doctor's appointments with her, helped her to choose which breast surgeon she would go with, which plastic surgeon she would go with, all of that. I was also the individual that gave summary emails to friends and family so that she didn't have to tell the story over and over again. So I had gone through that year-long battle with her. I had released her in April of 2008. I had my baseline mammogram in February 2008. All was negative and clear. October 1st, 2008, while I'm waiting for my mom to make it to inpatient hospice, and I'm waiting for that phone call. And so I'm multitasking. I'm doing my self-breast exam. Oh, whoa, wait a minute. I feel something in my right breast that was not there before. The moment that I felt it, I knew that it was cancer. I am not a pessimistic person, but I do know my body. And I do believe that there are times when certain things impact you. You just know. And no matter what people say around you, you're not damning yourself. You just know. And so coming up with that realization and accepting it, accepting the diagnosis, and not living in so long a period of denial, I think really also helped me. And so I felt the mass. I immediately called the breast surgeon, because now remember, I have a whole list of them because I had went with my friend to all of her appointments. So
Right.
the best one she chose, that was the one I chose. And now I had her home number, her cell phone number. I called her at home at 9 o'clock at night, told her what happened, and said, hey, let's skip the madness. Am I going for a diagnostic mammo? Boom, boom, boom. What am I doing? And so, long story short, October 13th, she called me at home and informed me that my pathology, my biopsy, had come back positive for invasive ductal carcinoma. And so,
Mm.
October 22nd, I underwent what was supposed to be a lumpectomy and a lumpectomy and a sentinel node
Mhm.
dissection. That was it. But it turned into a partial mastectomy, and where they removed half of my right breast, and they removed 16 lymph nodes, 3 of which were positive for cancer. And so what that meant for me was that I was looking at chemotherapy and radiation for treatment. And I underwent 15 rounds of chemotherapy and 33 treatments of radiation. I only missed 3 days of work. Those were the 3 days that I was in the hospital for surgery. And so most individuals did not even know that I had been diagnosed, because I went out on a Wednesday and had my surgery. I was back to work on Monday. And a lot of times I was doing work at different facilities. I was overseeing 16 facilities. So when people didn't see me, they
Mm.
just assumed that I was in
Right.
another facility. And I started wearing wigs before chemo,
Hmm.
just to prepare myself. So they had gotten used to seeing me blonde one day and brunette the
Right.
next, and short hair one day, long hair the
Right.
next. And so it just became a fashion statement. And so I ended up being my plus one. I didn't have anyone going with me. I was newly legally separated, and my mom was in end stages of her life. It was just so much going on with my life. I just felt like nobody else could tell my story the
Mm,
way I could. And because I had a rapport of physicians that I could rely on, I didn't need someone to help me choose. Now, in retrospect, I look back and I realize I probably should have had someone to come with me, because after a while, even as a physician, you start hearing wah, 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 wah.
right.
And, I had
Yep.
to impress upon my doctors, I'm in patient mode. I know that I'm a
Right.
doctor, but please talk to me like a patient,
Right.
because it was a lot to endure. So it was a very different, very trying time. Completely changed my life. And I was the
Yeah.
only person who had ever been
Oof.
diagnosed with breast cancer in my family. Matter of fact, if you talk to my family, I was the healthiest person they knew. I
Mhm.
exercised every day. I ate right for the most part. I had my cheat days, but I was doing things right. My only risk factor, my main risk factor, was that I was a woman.
Mm.
Yeah.
And I'm just listening to you, and the first of all, just mom is having her life struggle. You're having issues, obviously, with your husband.
Hmm.
And man, I'm just happy. I mean, that you actually knew enough about your body to check yourself. And it was, even with my mom, it was like one mammogram was okay one year, and the
Hmm.
next year it was abnormal. I
There
mean,
you
it was
go.
just like that sudden. So it really illustrates the value of making sure that women who are listening, it's much easier to treat something early. In fact, I lost my grandmother to breast cancer, and she simply waited. By the time she was seen, you could visibly, I didn't see it myself, but my understanding is that you can visibly see something growing on her breast. It was
Yeah.
like at that point. So when it gets to that point, it's probably already made its way elsewhere. I also
Right.
like the fact that I know you have a spiritual background. I'm going to ask you about that a little bit later, but um, praying with patients, it's funny how docs, they're so like, let's be a doctor, let's diagnose and treat. And what they don't understand is that, you putting your hand on a shoulder, you saying a brief prayer with a patient, if that's your, background, is probably more important than the diagnosis. I just think, you know what
Absolutely.
I mean? And I'm sure you found that. So I think for anybody who's a clinician out there, be comfortable going to where you need to go to help patients along their way. So I really appreciate that. So you said that risk factor that you had was being a woman, but what about persons of color? Have you seen that breast cancer affects women of color more?
Oh, absolutely. Here's the deal. You can have white women to be diagnosed twice as much. However, black women die from the disease at a 40% higher rate. And
Wow.
so typically when you're dealing with black women, we are getting diagnosed later. Triple negative breast cancer is running rampant amongst black women. And even if you normalize for access to care, um, breast surgeons, plastic surgeons, we still are not running neck and neck, or really experiencing health equity as it relates to breast cancer. We're dying at a higher rate. We are suffering at greater morbidities, and a lot of it is multifactorial. There are cultural differences. Individuals like to say, "Oh, well, there's a huge genetic component." The When it comes to genetics and the number of inherited breast cancer cases, family genetics is way, way down on the list. It's so
Mm,
small. And so
mhm.
people want to think that, oh, well, you're black. You're a black woman. Yeah, of course you got breast cancer. But me being black, that wasn't the genetic cause of my breast cancer. Certainly, there is an inherited component to breast cancer, but it is so small in the number of cancers that are out there. And so it's really important for us as black women to educate ourselves about the process and what needs to be done. I've moved away from the term of breast cancer awareness. I think we're all aware of it. I don't think any of us has not been touched by it. We know a neighbor, we know a coworker, a family member, ourselves. Um, So we're aware about it. We're aware of it. But what are we doing? How are we educating ourselves? How are we moving past that fear and that denial? How are we moving past and incorporating our faith in our diagnosis? For those of us that are faith based, faith without works is dead. And part of your works is getting in and getting diagnosed and getting treated. And
Mm,
so, we go beyond just having the faith and praying. Absolutely, I pray. But ultimately, I know that God was my healer, but God also gave me provision. God says, those of us that are sick, we are in need of a physician. Absolutely. I was in need of a physician. I went, I followed my instructions, and I gave it to God, and I
mm,
came through. But I can't say that I have faith and I don't use the tools that God has made available to me in order to get the help that I need. And so we as Black women have to incorporate our faith in our diagnosis, but not rely solely upon our faith and prayer for healing.
mm. You
Yeah,
preaching. I think that's you are. And it touches me because the number of conversations I've had with particularly my African American patients about, doing certain medical things, and they say, well, God got this, and it's shocking that they would then make that statement, which I don't have a problem with at all. But then to say, I'm not going to do anything, and to not recognize that, well, God may have sent these people into your lives to help you, and we
correct.
have to get their help. And then that's the way he's going to bless you. So I really think that's a great message to share. And we want people to definitely have faith, but don't get the way it's interpreted twisted. I think that we're supposed to take advantage of all the gifts that are out here to help serve us. So thank you for that. And even as you're talking about risk factors, I'm in the obesity space. So one of the things that I think, well, even relates to cancer. I read a study recently that talked about risk factors for cancer, and interesting enough, obesity was like up there big time, like in the
Hmm.
30% range. And then they had smoking. But then they're both like in the 30% range for risk, right? And then
Right.
everything else was like in the single digits.
Hmm.
So, and those first two are very much something that we could do something about. So,
Very much
you know what
so.
I mean? So I think that
Obesity
mm,
in Black folks is
mm.
rampant. And
It's
you
more
and
like
I know.
normal. Yeah, it's more like the
Yes.
normal. Like finding a skinny person is like what's abnormal. It's the
Exactly.
opposite.
And
Yeah.
and we have to change that. And we don't appreciate, again, that's where that education comes in.
Mhm.
Because you and I both know obesity is a risk factor in just about every significant major chronic illness,
That's right.
life-threatening illness you can name.
That's
And
right.
yet we don't take the steps necessary, the
Mhm.
steps that we could take to diminish that risk. We as Black women, and a study was done a few years ago at Harvard Medical School looking at the differences when it relates to breast cancer amongst Black women, Hispanic women, Asian women, and white women. And a huge thing that Black and Hispanic women shared is that when we are diagnosed, the first thing we think about is what's going to happen with my family, what's going to happen with my children,
Mhm.
what's going to happen with my
Mhm.
husband. I need to put this together.
Mhm.
When the study looked at white women, and this study was done using AI, and it was just gathering all of the conversations out there, not just on social media, but every website where it wasn't a pointed question. These were just women having open conversations, right?
Gotcha.
And so, based upon these open conversations, when women are diagnosed, their immediate thought is, okay, what do I need to do to treat?
Mm.
What do I need to do to make this go away?
Wow.
Just that shift in mindset, just
That's a
that
big
one
difference.
shift there.
Yeah, it's a huge difference.
Isn't that major? Isn't
Yeah,
that major?
it's crazy, and it's just an interesting way of seeing the world. And I know we are a reflection of our life experiences and the beliefs of the people we've been around, et cetera. So I'm sure some of that comes from those various factors. So wow. So I was, when I learned of you, and that was years ago because we've been Facebook friends for a while. But
Yes,
when
we
I
have.
when I've learned of you, of course, you have the diagnosis and all those dissections of axillary lymph nodes led to lymphedema.
Mhm.
So as I wanted you to explain a little bit about your profession, I think it's helpful for people to understand what lymphedema is, but more importantly, how does it affect your life? And I think a lot of people don't think about that, but I want you to kind of share your experience with lymphedema.
Yeah. Lymphedema, first of all, people need to understand that your lymph nodes are part of your immune system. So they're located strategically throughout the body, cervical in your neck, in your axilla, in your pelvis, and they're helping to remove inflammation. And so I describe it to individuals. Just imagine all of the little micro traumas that happen to your body. You hit your hand up against a desk, you're opening a refrigerator, you're going grocery shopping, you're writing, you're typing, you're walking, you're doing all of those insults. And so sometimes you may notice like, oh, I can't get my ring off. It's a little tight. But then the next morning you're able to pull it right on off. Well, your lymph nodes and your immune system did what it needed to do. All those little micro insults, they got rid of them. Well, when you remove 16 lymph nodes, you blast your axilla and your neck with radiation. It killed all the lymph nodes, my right neck, right side of my neck, and in up under my arm. What that meant is that my body's ability to handle all of these micro insults in my right arm, hand, and fingers, they were gone. And so now I was left with this severe, painful swelling that you feel like your hand, your fingers, your arm is about to pop. And a lot of times I felt some of these symptoms prior to even noticing the swelling. It felt full, it felt tight, but when I looked at my hands and my arms, they felt the same. And so that feeling was my early indication. However, as a physician, I know what lymphedema is, I know what could cause it. My radiation oncologist mentioned, 1 to 2% of people develop lymphedema, but you got to get treated. I'm not going to not treat my breast cancer over 1 to 2% risk of lymphedema. Even if it was higher than that, I was still going to get treated. But what I and my physicians didn't know at the time is that 1 in 3 at-risk cancer patients will develop lymphedema related to their cancer treatment. And 50% of those individuals will usually develop it within the first year. I was classic for that because literally a year within my treatment, boom, my right arm, hand, and fingers swole to a massive amount such that I could not perform the clinical functions of my job. I couldn't do those specialty examinations. I mean, I was doing examinations where I was testing for glaucoma, using a slit lamp, dropping in drops, sewing up lacerations. My fingers were literally too fat. And so when I tried to wear the over-the-counter garments that, people told me to get, now the garments were so tight I couldn't move my fingers. And so now I freak out. Because I'm right-handed. And when I went back to see my breast surgeon, because I wanted to rule out that it wasn't a secondary lesion or mass that was forming. When we ruled that out, I ended up going through 4 months of daily physical therapy, Monday through Friday, massage, wrapping, exercise, all of that. Taught myself manual lymphatic drainage. But what people need to appreciate with lymphedema, 1 in 3. So 1 in 3 will develop it. There are about 300,000 to 500,000 cancer survivors yearly developing lymphedema. Now, we have our treating physicians who mention it, but they are not even aware of how large that number regarding the risk of it is. And so now there's this push and this move to educate physicians. Hey, we're physicians. We can't know everything. We're physicians. We are not God. But once that data becomes available, it behooves us to spread that word so that individuals know. Because like for me, I'm a doctor. I wanted to be a doctor ever since I was 2 years old. Now I cannot use my right arm, hand, or fingers. And so boom, in an instant, my clinical career over. Even after 4 months of physical therapy, the best they could do was to get my swelling down enough such that I was able to have a custom garment made, sleeve and glove, so that I could wear it to keep my swelling, 1, as reduced as possible. Two, to protect your skin, because now if you get cut, a burn, or anything, it takes longer to heal. You can have complications if you get infected, an infected cut or wound. Now that infection could spread to your bloodstream, and having bacteria spread to your bloodstream could lead to septicemia and could lead to death. And so individuals need to, one, appreciate that it is a significant risk factor. But here's the great news: there is now a device out there that's available, that's getting out there to many cancer centers, many health systems, that can actually measure the intracellular, extracellular fluid, and total body water, and be able to detect the slightest difference between from before you've had surgery, and they measure you every 3 months for the next 3 years. That sounds like, oh my God, I got to go every 3 months for 3 years. You are literally coming in, seeing your doc, getting checked in, or seeing your physical therapist. You step on this machine, 30 seconds, step off, you get to go home. But what the clinician now does is look at how those numbers have varied. When you get within a certain degree of variation, you can put on compression garments for 4 weeks and now nearly eliminate your possibility of having to live with chronic debilitating lymphedema for the rest of your life. Had this machine been available to me 12
Wow.
years ago, I could still be practicing now. But
Mm.
I'm not an individual that focuses on what I've lost. I'm an individual that focuses on what I still have. And what I still have now is a big mouth and the ability to now share with others. You do not have, your story does not have to be mine, and your testimony can be very different. All you need to do is ask, hey, do you have a SOZO device here? Do you have a
Right.
lymphedema prevention program here? I
That's
want
right.
to be included. And if they say, well, no, we've never heard of it, well, you know what? They can go out to my website, find out about it, or say, you know what? Could you find one? Because I know that there are out there.
Mm.
Because people forget that their physicians we are there in a place of service. And so even though we may give directives on what to do to better take care of your health is a partnership. And so now educating individuals about lymphedema, about really what that true risk is, and about how they could avoid the pitfalls that I have experienced, I can now turn my mess into my mission, and some of my misery into my ministry.
Well, thankfully, being a patient and a physician has really allowed you to have some really great perspective. I know we have a lymphedema clinic, and most of these lymphedema patients are not like you. They have lower extremity issues, but it's one of the most challenging conditions that we face. And a lot of the clinicians themselves, since they don't have that training, they feel a little bit handicapped for two reasons. One is because most clinics don't have a lymphedema clinic in the building like I do. Secondarily, they really just don't know how to treat it. So I think I'm so happy to hear about that technology that's coming along, and it's going to help patients benefit, because again, it just sounds like just basic tasks. Give me one example of something that was easy to do at home that you can't really do now as well because of lymphedema.
Mm. Oh, one, cook. I
Hmm.
don't cook the same thing. So I can't stir. I used to, the holidays, making different batches of cookies just so that I could share with my
Mhm.
nieces and doing things. I can't do that anymore. The way I wear my hair, um, I can tell you this: by becoming very comfortable with wigs prior
Right.
to my chemo, it has
That's
come in handy. I go to the beauty shop much more often now to get my hair washed and stuff. I was raised doing that stuff on my own. I
right.
don't wear things with little small buttons anymore. I wear things with an easy zipper or just pull on style. I'm on gabapentin now for the rest of my life because of the
Right.
neuropathy from the chemo and from the pain from the lymphedema. Even little simple things like being intimate with my
Yeah.
husband.
Right,
You know,
right,
at night I have to wear what I call my oven mitt. It
right.
literally looks like an oven mitt that comes all the way up to my shoulder, and it just exposes my fingernails. But the
Mm.
rest of it, so that spontaneity is kind of gone. You just kind of have to
Yeah.
say, "Hey,
Yeah.
boo, what we doing?
Yeah.
What
We're
we doing?
gonna
We doing it
let's
now?
schedule this.
Okay." Before I put on the sleeve,
Right. That is so
So
funny.
in physicians, I myself included, did not think or wasn't even aware of the many psychosocial impacts of lymphedema.
Mhm.
I give the example, imagine a woman who she finally gets her own hair salon. She's been working booths at other people's places. She finally gets her own. She has clients willing to wait hours just to have her do their
Mhm.
hair. And then now she has lymphedema. Now
Mm.
she loses her shop. She loses
Yeah.
her livelihood. Now, what does she do? She
Mm.
now has the extra financial responsibility of buying garments to control the swelling. She has to buy new clothes because one, her blouses don't fit. One arm fits okay, the other arm doesn't. We change how we dress. We're wearing long sleeves to cover up the garment itself because the garment is unsightly or unattractive. So it affects every single area of my life. And not to mention, putting on the garment every day is just a constant
Oh,
reminder of your
yeah,
cancer
just,
experience.
it has to be.
Yeah,
I helped a patient today who had some lower extremity issues, and they had a similar garment for their lower extremities, and just like, and one of the things she said, if we take this off, you got to help me put it back on, right? So
exactly.
she warned me, and of course, no problem, but it's a little bit of a job. So
But
wow, and that
imagine with this technology in
yeah,
lower extremity, this technology is just not for upper extremity
that's
lymphedema.
a good
It's
point.
upper and
Yeah,
lower. So
yeah.
imagine with your legs. I mean, putting on I, I can, if I had to choose between arm and leg to live with this, I would choose arm. Simply because leg, I have worked with patients trying to get compression garments on your leg. It is, and I see so many individuals, especially with lower extremity, because it's so easy to put on, long pants. Um, they won't treat, but this
Hmm.
simple device can detect it and throw on compression garments for 4 weeks versus the rest of your life. I'll choose the 4 weeks
Yeah, any day,
any
any
day.
day.
Yep.
Yeah, so that's awesome. So so you've had a chance to be a patient, and I just had the coronary artery calcium score test. I was thankful that it was it'd be kind of embarrassing to be this low carb keto guy, and I have clogged arteries. That wouldn't go very well. So so I was holding my breath, right? I was like,
Right.
please, Lord, I have a purpose on this planet. So that turned out I had a score of 0, thankfully, and had a colonoscopy at the beginning of the year before the pandemic. And so I was a patient in that setting. And I was also a patient as a COVID vaccine receiver. So that
Yay.
was great, thankfully. And so yeah, so those are the only times I've really been a patient recently. But so you've obviously had a chance to transition from physician to patient, rather it's the chemo, lack of hair because of what you've shared about having to wear a wig. So I'm curious, what was that like? But more importantly, the health system. How did the health system treat you when you were kind of flipping your roles and becoming a patient?
Well, I can honestly say overall, the system treated me well because I got treatment where I was employed, and I was executive management, so it wasn't like people didn't know me, and those individuals who had not seen me personally knew my name. So when the name came by, they knew.
That's
So
right.
I was blessed in the sense that I did decide to have my treatment within the same health system within which I worked. But I was taking a chance, because there's more individuals knowing a little bit more about you than just coming and going to work. So
Right.
that experience, they treated me well with that regard, individual people. And I am still close and tight with some of those individuals to this day. Where I did find problems with the health system was dealing with the insurance side. I chose to be a
Mhm.
part of a clinical trial, and I will admonish everyone under the sound of my voice, regardless whether it's cancer, whether it's chronic liver disease, whatever it is. If there is a clinical trial, please, Black people, Hispanic people, please get yourself out there and be a part of clinical trials. I know that there is a mistrust of the healthcare system. There was no issue with that at all.
Mm.
Treated with pristine care. They broke down the clinical studies to me. They understood every step. If there was any questions, they clarified it. So that was great. That was my contribution, not only to potentially help me, because the drug, whether or not I was receiving the particular study drug, if I was receiving it, it could help my survival, but I was doing it for generations to come. I had two daughters who would now benefit from my participation in this clinical trial. Where I ran into trouble was the insurance company not understanding that even though I was a part of this clinical trial, I still received the same standard treatment of care. So the only bills they received were true bills that they would have received had I not been a part of the clinical trial. Anything that was related to the clinical trial, they didn't receive a bill for. But unfortunately, individuals that initially do the review, they don't necessarily have as much clinical knowledge and experience as physicians, and or he or she didn't have a knowledge, didn't take the time to read through the documentation that they were sent, but they denied paying for any of my chemo, any of my treatment.
Mm.
All while I was going through chemo, I kept getting, $45,000 bill here, $60,000 bill there, because they refused to pay for it. And I kept telling them, no, I sent you in the planned documents for this clinical trial. This has nothing to do. And I had to ask my oncologist to write out a letter. I had to do an appeal. And as a patient going through treatment, and you're the one that's driving yourself to and from chemo, you are co-parenting, raising two children who are trying to adjust to their parents not being in the same home. You're dealing with, your mom being in at her end stage of life, and then her transitioning while you're going through chemo. That was a lot to bear. And finally, I realized, stop it, Sheri. Just call them and ask to speak to the medical director. But
Mhm.
most lay people wouldn't know to do that.
That's
And
right.
I don't know if most lay people would even get to the medical director.
That's
But
true.
I'm sharing this part of the story just to let you know, don't accept pushback when
That's
you
right.
know that what you're being pushed back on is not right. You go out and you seek sources. So I asked my medical oncologist, baby, I'm sorry, you're gonna have to write, it may be a 2-page letter, it may be a 4-page letter. But what you need to do is to
Mhm.
go in and stress and delineate what I've been getting and what should be covered, and what I've been getting that they have not even seen a bill for. I went to the principal investigator, told them, give me a simplified document such that they understand what is covered, what is not covered, so that I cannot have to deal with this. And then finally, when I talked to the medical director, I was cool for a while, Tony. I held my own. I went
Mhm.
through and I was and then towards the end, I lost it. That's when
Mm.
that real patient came out, and
Mm.
I overflowed with tears. And after I pulled myself together, I said, you cannot imagine. I said, is your mom living? And he was like, yes, she is. And I said, has she been diagnosed with breast cancer? And he was like, well, no. And I said, well, 1 in 8 women will. If you
Mhm.
were, if this was your mom, what would you do?
That's
I said,
right.
you know better. If this was your mom, what would you do? And then the
Mhm.
next thing I know, I got a call after I got off the phone with him. About an hour later, the case manager
Mhm.
called me and said, "Oh, we're going to approve everything." But that was
Mhm.
9 months. I had started chemo December 1st. I finished April 20th. I got the call that they finally approved it in May. And so that part of being a patient, you and I both know that's why it's so important to have more clinically trained medical professionals in certain industries to help better effect the care of patients. If you
Right.
only have MBAs making the decisions as far as insurance claims, we're never going to receive the type of treatment we need to get. We need more physicians in there that understand what's really needed and be able to tweeze out the differences in order to make it smoother for a patient's journey. because that added a lot of angst to my journey that didn't need to be there.
Yeah, it's a lot of stress.
Yeah,
And who knows how that impacted your care. We know stress has
absolutely.
a negative impact on our bodies, and we're trying to heal. And all the metabolic things that are not going well because of stress. So I'm sorry you had to experience that, but I'm also grateful that you were able to face that in a way, even though you had to snap a little bit
Right.
and you had to do what you did the sister thing for a little bit, but
That's
you have
right.
to let people know, listen, you
That's
know.
right.
So that's a crazy thing. I remember when I was doing a little research on you, I saw a picture of your mom and I thought I was looking at your twin. I think, I was like, wait a minute now. I mean, and maybe it was a younger picture of her. I don't know what it was, but it definitely looked just like you. So I know you miss your mom
Yeah.
a lot, and I don't have to say that but once, and I know she meant a lot to you, and she probably laid the foundation to make you who you are today. So when you think about your mom and the foundation she laid for you, what do you think that's what gave you the strength to battle breast cancer? I mean, where did all this strength come from?
Absolutely. Absolutely, my mom. I can tell you this, when I was diagnosed, my mom was in inpatient hospice. And when I went to visit her and I finally told her the diagnosis, for 3 years, I had been, um, my mom would always use this term, I'm planning to live, but preparing to die. She had sarcoidosis and it affected her lungs tremendously. And we had did everything we could, even looking into a bilateral lung transplant. And when we finally got the final answer, no, we've done everything we possibly could. As the executor of her state, I was responsible for doing a lot of her pre-arrangements for her homegoing celebration. And when I was diagnosed, my mom looked at me and she's like, all this time I kept saying, Lord, why am I still here? Why am I still here? I mean, every holiday, my mom would say, well, I guess I made it to Christmas. I don't understand why I'm still here. And my mom said, now I know why I'm still here. Even
Mm,
though I can't help you, a baby needs her mommy when she's
mm,
diagnosed like
mm,
this.
mm,
And she said that, and that's exactly right. I didn't need for my mom to necessarily do anything, but I did need for her to be there. And my
mm,
mom taught me how to live and die with dignity and grace.
mm.
My mom um, married very young. I mean, she was a great grandchild of slaves, married at 15, first child at 16, high school dropout, born in Sharon, Mississippi, took
Mm.
care of family. But about 5 years after her baby was born, i.e., me, she decided to go back and get her GED. And this woman scored in the top 5% of all people who had ever taken the test since it began. Ended up getting all A's in courses leading to an associate's degree, and she went on to become one of the United States leading investigators for the Equal Employment Opportunity Commission. And so
Wow.
my mom showed that she was not only living her life with purpose, but she decided to restructure her life and become a role model for her four children. And she didn't want other people to set the paths or be role models for us. And so, although my mother never obtained her college degree, she never obtained the master's or PhD, she held a job that other PhDs could not get. But yet she remained humble and reminded us of the fact I'm in this position because one, I work hard, but two, God has given me favor. And I want you to always remember that if you plan to succeed in anything that you choose to do, I need you to work hard, and then when God opens the door, I need you to give him glory and I need you to allow him to get the glory out of your life. And so she definitely laid the foundation for me to have the strength to go through. I didn't ask the question, why me, when I was diagnosed, because, the response could be, why not you?
Hmm.
Um, and even though when I was going through my trials, I wanted to give up, especially I did not want to be here without my mom. And there was a time when I was really ready to let go. And in effect, I did let go. But God said not so. Um, but when I came through it, I realized that um, none of this was any surprise to God. He knew exactly the state that my mom would be in, and when I was diagnosed, And now, even until this day, the choices that I make, whether they're professional or personal, um, I make them with my mom in mind. I still want to do things that would make her proud, that would bring grace and dignity and an amount of uh, elevation to the legacy that she has left in me. And so Yvonne still lives, and she lives in me. And I'm always over the moon when somebody says, "Oh, you look just like your mommy." And, and I love it because my mom was absolutely gorgeous. And whether or not you looked at a young picture or an older picture,
She
it's
was.
weird because sometimes I'll look at pictures of my mom and I'll say, "I remember taking that picture." And then I realize that's because you didn't. It's not you, it's your mama. So,
Wow. I
yeah,
saw the resemblance. It was pretty striking. So
yeah.
it was pretty cool. So well, I know one thing. The first download of this podcast episode, I'm sending straight to heaven. So I want her to be the first person
There we
to
go.
listen to it. I tell you, that is. So shout out to your mom and thank you for helping to create you. And we just wanted to acknowledge her. So thank you for giving us a little bit of her. And wow, my last podcast episode, I had a Dr. Shayna Peter, and I actually met her when I was doing one of those Diabetes Expo events, and we shared a table as we spoke about prevention and things like that. And she wrote a book called It's Not Just Acne, but she's a functional medicine practitioner, and she focuses on the root cause of disease, which is really the foundation of this whole nest and rope way of thinking. And so I'm curious with your experience, did you consider any alternative treatments or, non-traditional approaches as treatment options when you were trying to decide what to do about your care?
I did, and I viewed and took advantage of some of those alternatives as adjunct therapy. So not in place of,
Yeah.
but I in with the knowledge and working knowledge with my oncologist. So I never took any additional supplements or did anything in addition to my care without first discussing it with her and letting her know what I was doing, because there were some things that would get in the way of my chemo. And then there were some things that she said, it's not going to get in the way of it, but it's not going to have any impact. So you're going to be wasting your money. So just wait until after your chemo is over. So there were various different supplements. I incorporated Reiki. I incorporated acupuncture. I incorporated taking lipoic acid initially for my lymphedema for the pain, which helped tremendously. And so I encourage everyone that everything does not have to come through a prescription and or from a facility. Back in ancient times, you know that individuals lived for a considerable amount of time, and there were individuals who were healed of certain diseases, and they didn't have PET scans and SPECT scans and MRIs and Taxol and Taxotere. They didn't have that, and so I never negate natural sources. But for me, it worked better to use them as adjunct therapy, additional therapy. I incorporated that into my prescriptive treatment processes, if you will. I was not an individual that felt strongly enough about any particular functional medicine alternatives out there that would cause me to replace chemo or replace radiation or even diminish the doses of either of those. But I did sought out and I did use things that work together with it, help my skin not to turn as dark, help me to keep my fingernails and not have them fall off, and different things of that nature. So, yeah, I think it's very important. And if you hook up with the right people, or the right practice, functional medicine used in conjunction with traditional medicine is awesome.
I like that. It sounds similar to how we talked about religion and how you have to be careful not to just do that one thing. You
There
have
you
to
go.
it's the same way of thinking. So I appreciate that. And I also appreciate what you said earlier, talking about your big mouth, and your big mouth got you a job with the Susan G. Komen
Yes, it did.
Foundation. So I'm curious, when you're a physician, and then you didn't choose necessarily to do that until it had to happen. What was it like to be their spokesperson?
Awesome. It was the timing of it. It was just absolutely incredible. I had participated in my first Susan G. Komen 3-day as a survivor, August of 2010. And it was amazing to be out there on a 3-day. And the 3 days where you walked 60 miles over the course of 3 days, you raise money. You had a minimum of $2,300 you had to raise to walk. And you're raising awareness and you're walking around in all your pink and rah, rah, rah. And people are cheering you on. It was just, oh my goodness. I felt like a rock star. That's how they treated survivors out there, like a rock star. And then I went through my 4 months of physical therapy. And while I was out on physical therapy, the organization that I was working for, the boss that I had at the time, who was not a physician, by the way, told me, Sheri, a physician who is not clinically capable is of no value to me.
Mm,
And subsequently, while I'm out on FMLA, did
mm,
something that he was not supposed to do. And I, in occupational and environmental medicine, I am trained in this, and I actually served as their director of the Disability Council, terminated me.
mm.
I'm out, didn't even know that I was terminated. But then I got the word that I was terminated. I could have chose to fight, but Tony, at that time, I heard no value, and my mom was gone. And at that moment, I wasn't strong. At that moment, I heard no value, and that's how I felt. And it took me a couple of months to really get myself together. But within that couple of months, Coleman put out a call looking for a new national spokesperson, and they sent an email to everyone who had participated in the 3-day from 2007 up until that point in January of 2011. And I
Mm,
thought about it. I'm like, you know what? I don't have a job.
mhm. Right.
I think I could do that. I'm like, I'm looking at what they said. Needed knows a lot of travel, a lot of speaking. Obviously, we can hear whoever's listening to this. I have no problems talking. And so I said, well, let me give it a shot. And it wasn't that easy, though. I'm telling you, their process was grueling. I mean, it was
Mm,
video, in person, on the call with 6 other people interviewing you. I mean, it was a
mm.
rigorous interview process. But after 586 applications, they offered the job to me,
Oh, wow.
and I literally was floored. We all the last 5 candidates, I think it was 4 or 5 of us that were brought
Mhm,
in to actually for the in person, and I believe it was on a Thursday, and they told me, okay, that was supposed to be the last step. And then they said, oh, we got one other thing. Give us a couple weeks. We may need to bring you back in. And in my mind, I'm thinking, oh, maybe they need to bring me in, to meet the CEO or,
mm,
Nancy Brinker or something. And so I waited. That was Thursday, and Friday. Well, maybe that was Friday. And I think Monday I got a call, whatever it was the next business day. And I thought for sure they were telling me, sorry, you didn't get it, because they told me it was going to be 2 weeks. So if I'm hearing from them this soon, obviously I didn't get it. And then she was trying to figure out a way to say, she goes, you know what? It was a unanimous decision. We want you to be the spokesperson. It was easy for me, Tony, actually,
wow.
because one, talking with my patients and with families was something that I always did. I took the time to explain in layman's terms, make sure they understand. I was never an in and out kind of doctor. And so part of my bedside manner helped me to be open to listen to the stories when I'm out there on a 3-day, and individuals coming up to me and telling me their various different insults that they have been experienced as a result of their diagnosis, either from family, friends, people they lost, etc. So I was accustomed to that. I was not accustomed to, doing public interviews and being on TV and all of the PR that came with it, but they trained me for that. And it was an awesome healing experience, healing for me and healing for the individuals that I impacted. There were millions of people that I impacted with just interviews alone, but there were hundreds of thousands of individuals that I had the absolute opportunity to touch, feel, and hear. over
Mm-hmm.
the 6-year period when I served in that role, and it was phenomenal. It was not without its challenges, because Coleman has gone through quite a few changes, and they went through a major change while I was in that role. Um, but that taught me. I learned. I take every experience that I go through as a learning experience, one. But then two, at the end of the day, like I always say, God, get the glory out of my life. How can I take this stage and impact not only the individuals that are under the sound of my voice and are here to participate in the 3-day, but when NBC News and ABC News and CBS, they're there, and the various different journalists are coming in print or blogging, what is it that I can say on this stage that's going to impact their life and cause them to go home and live differently?
Mm-hmm.
And that was the way I approached every single 3-day, every single moment that I came in contact with anyone. So it was a great transition. I loved it. I was sad when it ended.
Wow. Well,
Yeah.
just the impact that you've had and you're trying to have makes it obvious. I have to ask you about three things. One is I want you to talk a little bit about your Live Today Foundation. I
Mhm.
want you to tell me, uh, you know, how you use your spiritual side to impact the world. And then thirdly, your book. So all of these things are making an impact. So just speak a little bit about the foundation, your evangelism side, and then the book for sure.
Okay. Let me hit it real quick. The Live Today Foundation was really born out of my desire to um, make an impact in individuals that are living with lymphedema. My travels showed me that there were thousands upon thousands of women out there living with the diagnosis, not even knowing what the diagnosis was. They were never received a diagnosis, was told how to treat it, but couldn't afford the garments and or the physical therapy that was necessary. And then the healthcare individuals that didn't seem to know how to properly diagnose it, and they certainly were not aware of the psychosocial impacts of lymphedema. And so I started the Live Today Foundation to do those three things: educate physicians and other healthcare practitioners on how to properly diagnose lymphedema, and to tell them about the psychosocial impacts of lymphedema so that they can get their patients the resources that he or she needs to adjust and live with this new disease. Number two, make patients aware of the importance of treatment, what that treatment involves, and to give them resources on where to go. And then lastly, to provide free compression garments to under-resourced, underinsured, uninsured cancer patients and survivors living with lymphedema, because unfortunately, many insurance companies do not cover compression garments. Even though this is a bona fide disease caused by another disease, they still don't provide for coverage for the compression garments. And compression garments can run anywhere from the simple run of the mill $300 that you can purchase
Mm,
online to custom garments like what I'm wearing that's $2,500.
mm,
And so that's what the Live Today Foundation is. We've been in existence since 2017. We've helped nearly 300 women and men get into compression garments. We've helped physicians and other healthcare practitioners on how to properly diagnose. And what I'm most excited about is the partnerships that we have with compression garment manufacturers, and most importantly, and I shouldn't say most importantly, I would say I'm really most excited about is a new partnership that we have with a company called ImpediMed. ImpediMed is responsible for creating the device, the Sozo device, that does LDEX testing, that allows clinicians to detect lymphedema in stages 0 and 1 when it's reversible, where they can put on the garment for 4 weeks and now reverse ever having to live with chronic debilitating lymphedema. Lymphedema occurs in stages 0 to 3. So by the time you get to stage 2, when you see the swelling, it's non reversible. So I'm working with this partner to get as many lymphedema prevention programs out there and get as many SOZO devices out there as we possibly can so that individuals don't have to live with this. Me being an evangelist, I have been a licensed evangelist now, oh my goodness, 34 years now. And Yeah,
Wow.
I got into it young, and
Okay.
I've been preaching since I was 19. And the beauty of having that spiritual side is that I was able to create the very first health ministries within the Churches of God in Christ way back when. And now many Churches of God in Christ churches, that denomination, health ministries are almost the norm now. But I took it upon myself once I was in medical school. I realized, oh my God, we're in church. We talk a lot. Yes, thank you, Lord. We sing. We get our dance on. We got our music. We get our sermon. But where are people talking about health? We talk about praying. We talk about having faith, and absolutely we have to have all of that. But I'm looking around me and I'm hearing people get diagnosed prostate cancer, breast cancer, diabetes, hypertension, high cholesterolism, but the church wasn't talking about it. And so I started the first health ministries. And like I stated, they're going on now. And right now, pretty much with me is I cannot separate my faith from who I am. And so that a lot of times when you take the stage with a particular organization, they tell you be careful, don't use certain terms, be careful not to say Jesus, or be
Mm-hmm.
careful about saying God. And quite honestly, when I became a professional speaker, uh, I there were organizations where if they told me specifically to be careful, I was.
Mm-hmm.
But it's funny how when your faith is so deeply rooted and embedded in you, I never use the word, but people came up to me after my keynote and say, "Oh my goodness, girl, you were preaching." And there was
Mm-hmm.
nothing that I said that was the usual preachy terms that you would hear coming across the pulpit. But when it's deep inside you, you cannot separate it. I can't leave God at home like I can't leave my green eyes sitting on the counter. It's
Right.
all a part of me. And so I'm grateful that it's all a part of me because I get a chance to reach those individuals that are not faith based because I have the knowledge and the expertise. But then those that are, oh, they get hooked on.
They
They
get
take it to
extra.
another. Exactly.
They get a little
Exactly
extra,
right.
and then they can smell your authenticity. If you're
Absolutely
not being authentic, then they would know. So
correct. And
yeah.
then my book. Oh, when everything changed, my journey from physician to patient. I wrote my memoir. Really came out of journaling my experience when I was just journaling as a healing process. But the more and more that I began to speak and would share my story, I kept getting individuals from not all over the US, not only the US, but from abroad. I've spoken in Ethiopia and Costa Rica and Dominican Republic and Colombia. And everyone would typically say, "Oh my God, I just heard a little bit of it. What happened with the rest of it? Girl, you have to write a book."
Mm-hmm.
A lot of people tell you should do a lot of things. And I'm like, yeah, write a book. Yeah, right. Then somewhere, Tony, it just settled in my spirit. Maybe I should.
Mm-hmm.
So I
Mm-hmm.
pulled it together, not knowing what this was going to do or be or what was going to come of it. And by the time I finished, a dear friend who I went to high school with was an editor and was getting into publishing. And I was close enough with her that I said, I need you to read this.
Mm-hmm.
And I want you to tell me, is this for the world or is this just for me? Or
Mm-hmm.
those closest to me. I sent it off to her, and she was in South Africa at the time. And she said, listen, my Wi Fi is in and out. I read the book. All I can say is powerful. Second word, the second phrase she stated, the world needs to hear.
Mm.
And so I decided to be very vulnerable and open. And in that book, I share a lot of my experiences of what I went through with friends, with family, with career,
Mm-hmm.
with faith based, with church folks. And I didn't want to write a self help book, and I didn't want to necessarily be an autobiographical sketch either. So
Mm-hmm.
it's a combination of both. It's
Good.
real. It's Sheri, born and raised Sheri. When I wake up in the morning, I'm Sheri. When I go to bed at night, I'm Sheri. The MD behind my name is something that I worked hard to get and God blessed me to have. But at the end of the day, I'm just Sheri. And so I share Sheri, I share the doctor, I share the patient, I share, my mom's death, the loss of my marriage, my hair. In some instances, I felt my mind. But then it ends on an element of victory.
Mm-hmm.
of turning your test into your testimony, of making your misery part of your ministry and your mission. And then I kind of tell the complete story. And
Mm-hmm.
so it's a real life tale exposing all of my vulnerabilities to an onslaught of trials that would make any woman or man reel in defeat. But it took me through a journey of self discovery where I was left to be face to face with myself, my God, and my power. And it turned into a bestseller. And I'm
I
blessed.
love it. I love it.
Yeah.
And I want to thank you for just your authenticity. I want to thank you for being vulnerable and sharing, especially you share stuff about your bedroom, girl. You didn't run out. So I want to thank you. You know, I'm a guy, so that's how my brain works. but, but I'm going to tell you, I really appreciate you and all that you've shared. And I'm loving every part of it. So I do want to wrap up with, my classic question, which is related to my nest and my rope acronym. And I want you to think about that and what parts of that or what part do you plan to focus on over the next year?
Over the next year, I plan to focus on positive relationships.
Nice. I
Yeah,
love
because
that.
I'm finding as 2020 left out, it was those individuals that feed into me and that I feed into them. That reciprocity of
Mhm.
giving and receiving is powerful. And when I have that, regardless of what's on my plate, whether it's ramen noodles or a lobster tail,
Mhm.
whether or not my bank account says that all my bills are paid and there's $25 left or $2,500 left, the
Mm.
positive relationships in my family let me know that or positive relationship in my life let me know I'm not alone. When there is a need, the need will be met, and I can really truly participate in that reciprocity of giving and receiving. So that's going to be my focus.
I like that. And I always told my kids to think of their friends. And if we can't grow together, we can't chill together. So I think what you're saying, those relationships are vital. And we're just a reflection of all the people we hang with. So that's wonderful. I really, really, really enjoyed. I really want to do this like for another hour. And I guess we will spend a little time together on YouTube briefly, but I do want to give you a chance to make sure people know how to reach you, how to get your book, and of course, any final takeaways you want to share.
Yes, they can reach me at my website, www.drcherimd.com. That's DRSHERIMD.com. They can also learn more about the Live Today Foundation at www.live-today.org. That's LIVE-TODAY.org. I'm also on Facebook, Instagram, Twitter, all of those. You can find me at Dr. Sheri MD or Dr. Sheri Prentiss. And you can also get a copy of my book, not only at my website at drcherimd.com, but you can also find it on Amazon as well.
Wow. Well, I think I'm giving you a virtual hug, and I think my listeners are doing the same. So here it comes. I hope you can feel it.
I can.
And thank you. So thank you very much. And I think I think everybody really enjoyed your testimony. So thank you for being here today. I really appreciate you. And we will spend a little bit more time on YouTube in a moment. So for those who are listening and want more, we're going to help you bring 2021 in the right way. And we're going to share some tips on YouTube. So we'll make sure to have that in the show notes. So today we received a late Christmas gift to start our new year. We learned from an occupational and environmental specialist who faced a challenge and literally decided to face it and not give up. Are you facing a similar challenge? No matter how big or small, Dr. Sheri has given you some insights as to what can happen when you simply decide to overcome what you are facing. She woke up from what she thought was her last nap, her last night of sleep, and she just decided, you know what, I'm going to make something different happen. She decided to live today and each day like it was her last. And I really challenge everybody listening to do the same. And again, we're going to spend some time on YouTube to share some additional thoughts, but I just really look forward to you continuing to do your work. So again, appreciate you. And for those who are listening to this episode, I want you to continue to be well, be safe, and continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.